It was seen as a threat. Chemotherapy, dialysis, life-sustaining treatments that would be cut within days. A house of twigs that was ready to fall down. And the state of Hawaii was the big bad wolf. Or was it?
It was the state of Hawaii who felt a sense of kuleana in order to provide these types of services. And since then, the state has been doing what the federal government should have been doing instead.
This all started when Bikini got hot. And then Eniwetok. As from 1946 until 1962, these atolls in the Marshall Islands were used by the U.S. as a nuclear testing ground. Though the actual test areas were evacuated, for the peoples of the surrounding islands, the legacy of these bombings has remained in the form of high rates of cancer. In the early 80s, the United States entered into an agreement with the Federated States of Micronesia called the Compact of Free Association, or COFA,
which allowed open, free migration. We have some citizens who are coming who are not too familiar with the language, the English language, and some senior citizens too who are coming. And these are the people that are finding it very difficult to live because, first of all, they don't have the requisite education to find good jobs, good paying jobs that can pay for their living. So they end up applying for social service programs.
The compact stated that it was not the intent of Congress for the burden of caring for these migrants to fall on the individual states. However, in 1996, it was Congress that passed a law, which along with other federal benefits also deprived COFA migrants of Medicaid coverage.
In fact, the state of Hawaii does spend over $100 million per year on COFA migrants. And that's just what we documented through state services, through Department of Human Services, Department of Health, Department of Education. That's not counting what the private organizations like the nonprofits spend and the faith-based organizations spend on COFA migrants. So it is well over $100 million that the state of Hawaii spends every year, and we're getting reimbursed, $11, $12 million. That's clearly not enough.
I think that logically it definitely makes sense that the federal government should be funding health care for this population. However, the state does provide health care to individuals that reside here and has been providing that health care. And with due process, you have a right, if you're receiving a benefit, you have a right to notice before that benefit is terminated.